Hello, this is Dr. Gary Burton coming to you from beautiful sunny Florida, and today we're going to talk about liposuction surgery. We're going to talk about how the operation is done. We're going to talk about a couple of risks of the operation and the impact of future pregnancy following the operation. So liposuction is the removal of unwanted or excessive fatty tissue from a targeted area of the body. It's really hard to spot reduce fatty tissue from the body. We can lose weight globally overall, but it's hard to say, I want to lose weight over my flanks. I want to lose weight over my central abdominal wall. We can lose it globally, but it's really hard to spot reduce from a particular body area. And that's where liposuction comes in. With liposuction planning, we can have the patient identify that troubled area that they want to reduce, and then during the operation, we can strategically place an incision over that unwanted fatty tissue area and remove the fatty tissue using a conventional or standard liposuction technique. Liposuction can be done under local anesthesia or general anesthesia. For larger areas of liposuction, I prefer to do it under general anesthesia. I just think it's less traumatic to the patient overall. And nowadays, general anesthesia is very safe and very predictable, given that you have a good nurse anesthetist or a good MD anesthesiologist. I like to keep my liposuction OR time down to 2 hours or less. And in the state of Florida here, we're limited to 4 liters of fatty aspirate. That is the maximum amount that we can take under state guidelines, and that's a good rule actually. Liposuction itself is a very safe, very predictable operation, but when you get into the larger volumes of fatty aspirate, it becomes less safe, less predictable. So I like to stay safe. Your health is my #1 priority during this operation. So here in Florida, we're going to follow those guidelines and we're going to keep the operation safe. We first infiltrate the targeted fatty tissue with a tumescent solution, and the key medication in this is epinephrine. The epinephrine will go in, it's going to cause vasoconstriction, or it's going to shrink your blood vessels. It's going to limit intraoperative bleeding and postoperative bruising. So we put this solution in, we let it set for a good 15 to 20 minutes. Once the solution is fully effective, then we go in, usually through the same incision with a slightly larger cannula connected to a vacuum, and we move this cannula in and out, back and forth, and we remove the unwanted fatty tissue. Once the operation is over, sometimes I will leave the incision open and sometimes I will close it based on drainage, and then I'll put the patient in a compression garment. You're going to be in this garment anywhere from a month to 3 months following the operation. Following this operation, our patients would usually spend about 45 minutes to an hour with us in a recovery room, and then you're allowed to go home. You can enjoy a regular diet the night of surgery, and you can shower within 1 to 2 days following the operation. No swimming or sitting in a tub until you're about 2 weeks out, but you can stand and shower within 24 hours. You're going to have some bruising and swelling. Bruising is usually about 5 to 6 weeks, and swelling can be anywhere from 1 to 3 months following the operation. But most of our patients go back to work in 48 to 72 hours. I had liposuction myself. I had it done on a Friday. Saturday, I took my daughter to cheerleading practice, and Sunday I was at the grocery store with the family and back in the office on Monday morning. I returned to surgery on Tuesday. For me to stand and use my arms wasn't a problem. I couldn't bend over to tie my shoe for a couple of weeks, but I was able to stand and use my arms the following Tuesday in surgery. So most patients recover within a very, very short period of time following the liposuction procedure. Anytime you make a break in the skin, the bacteria we have on our skin can become internalized. So infection is one potential risk of this operation. Another potential risk of this operation is seroma or hematoma formation. And we know this can happen, so I'm going to put you in a compression garment, and you're going to be in a compression garment anywhere from a month to 3 months following the operation to minimize the chance of a seroma or a hematoma following the operation. Another potential risk of this operation is asymmetry or the need to have a secondary procedure, and that sometimes happens following the liposuction primary operation as well. A question I often get is, Dr. Burton, if I have liposuction today and decide to get pregnant in a year or 2, will that impact the surgery? And my response is yes, it can, but the impact should be minimum. And often you can correct it with simple diet and exercise. But as you ladies know, pregnancy will impact your entire body. It will impact your muscle tone, your skin tone, and also fatty tissue deposit. So yes, it can, but the impact should be minimum. And once again, it should be able to, you should be able to correct it with diet and exercise. The most frequent area that I perform liposuction on is the abdominal wall and flank area, but I also operate on the back. It can be upper back, mid back, inner thighs, arms, chin. These are just some of the areas where we can do liposuction. And yes, fellas, you can have liposuction as well. If you have an unwanted collection of fatty tissue anywhere in your body, we can use liposuction to remove that unwanted fatty tissue. Hi, this is Dr. Gary Burton. I hope you enjoyed your time with me today. If you have any other questions on liposuction, feel free to leave a comment below. We'll see you on the next video.